We turn now to the pandemic in America. Attorneys general in these 11 states filing a joint lawsuit today challenging the Biden administration's recently released plan to require either a COVID vaccine or weekly testing for anyone working at a business with more than 100 employees. Now, that lawsuit comes at a time when vaccinations around the country are on the rise. You can see here the average number of daily vaccinations hit a peak in early April before quickly dropping off, then rose and fell slightly over the summer, but then a steep jump over the last 10 days of October. That's right after health officials approved a Pfizer booster shot. And as vaccinations peaked in the spring, there was a drop in new hospital admissions into the early summer, although that figure started to spike as vaccinations then declined, peaking once again in late August. But since then, a pretty significant drop. And hospitalizations, though, could soon be dropping off for good with a new tool in the COVID fight. And NewsNation correspondent Tom Negevin live in New York. Tom, Pfizer confirms its new antiviral pill cuts the risk of hospitalization. Is this right? By nearly 90%.
89%, yes, Nichole. A lot of excitement about this, and especially in places like where we are right now. This is Mount Sinai West in Manhattan, a hospital that, whether people really realize it or not, they've seen a lot of video of. The ambulances lined up outside, a place literally under siege with COVID patients, a lot of cases, many deaths at the height of the COVID pandemic. So yes, this news being received in the medical and scientific community with a lot of excitement right now. People calling it an absolute game changer. That's what our experts are saying. Now, it still needs regulatory approval, but the drug maker says it plans to present its data to the Food and Drug Administration by Thanksgiving, hopes to be treating patients here in the U.S. by year's end, a lot more broadly into 2022. No timeline yet for sure. What this treatment does, essentially, a protease inhibitor, it blocks the virus SARS-CoV-2 from creating new virus particles, hence that incredible success rate in the trials they've done so far. The potential, the company says, to save millions and millions of lives. Here's what Pfizer is saying to us tonight.
Within 3 days of the symptoms, you have now 89% protection from disease leading to hospitalization with our medicines. And the data indicate 100% protection from death.
Actually, this is a very exciting development. So this is a specific antiviral. We have some other medications that are kind of non-specific, but this is specifically targeting a step in the virus's life cycle, having specific targeted therapeutics against the virus and having an incredible prevention strategy, which is vaccinations. Prevention and treatment together will get us in control of COVID-19.
And Nichole, I know you just spoke to your market, your Wall Street expert from the Hill, but this news, part of what sent stocks up, it sent Pfizer's stock soaring today. It ended the day up about 10.52%. This is the second antiviral to be developed of late. Merck has one as well. It was actually approved in the UK just yesterday. So, Nichole, a lot going on here, a lot of positive news.
Yeah, positive news. Stockholders certainly liking that news. All right, Tom, thank you. Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.